Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson with MedAxiom HeartTalk, and we are going to be talking about inflammation. It can lead to serious health problems, and we are constantly learning more about how it contributes to the progression of heart disease. So today we are speaking with Dr. Jeff Carstens, Cardiovascular Service Line Medical Director at UnityPoint Health, to explore this very important topic. So welcome to Heart Talk.
Thank you. Nice to be here.
Yeah, thank you. So let's talk about inflammation, because it is a natural immune system response. But why is inflammation in the heart so dangerous?
Yeah, so inflammation in the heart can be dangerous in a number of ways. What we think about traditionally is things like myocarditis or pericarditis, which is an inflammation of the heart muscle or a lining of the heart, which can lead to things like arrhythmias and heart failure. But we increasingly recognize inflammation as a risk factor for atherosclerosis or plaque buildup in the arteries. It can increase the risk of then developing blockages in the arteries to the heart or the brain or other parts of your body, and also increases your risk of clotting. So things that can lead to heart attack and stroke.
Yeah, a lot of things. And to be able to look at that early on, because can't you see that inflammation early?
So you could pick it up in some different kinds of ways. If we think general inflammation, things like the sedimentation rate or C-reactive protein are tests that have been done, blood tests. A number of years ago, what we call the high sensitivity C-reactive protein, or hsCRP, has been a blood test that's very well correlated with risk of cardiovascular events. You can look at some other things like interleukins and tumor necrosis factors and those types of things, but the hsCRP, particularly in the cardiac space, is probably the number one test for identifying inflammation.
So what are the implications of patients with these risk factors that you talked about that don't get the appropriate care to address cardiac inflammation?
Yeah, so again, they can go on to develop cardiovascular disease, blockages in the legs, the heart, the brain. They can go on to have strokes and heart attacks. Things like myocarditis can lead to heart failure. Pericarditis and other inflammation can lead to heart rhythm problems. So there's a number of different things that can happen as a result of this.
So do you identify the right patients for inflammation treatment using certain tests, or are these other risk factors that you look at? So talk more about the tests.
So again, the most common blood test that we use in the cardiovascular space is that hsCRP, or the high sensitivity C-reactive protein. There are other tests that we can do to look at inflammation. There's scans that can be done. There's vascular reactivity testing. That's pretty specific and pretty it's not available everywhere. The blood test is very simple, can be done anywhere. It's really very helpful. And then there's other things that we know. If you have risk factors for cardiovascular disease, that's also important if you have inflammation. If you have a history of coronary disease, inflammation is more likely. If you have an inflammatory disease like rheumatoid arthritis or some of the other rheumatologic problems with inflammation, that could be an issue. And then things that people have just in their day-to-day lives: obesity, metabolic syndrome, kidney disease, sleep apnea. All of those things can increase inflammation and put you at higher risk.
Should patients be asking for them, or should doctors kind of be looking at that whole picture for recommending them?
Well, patients should be their own advocates, right? Patients should always advocate for themselves. Doctors also should be looking for this. This is something we look at. And in the past, it's been sort of an issue of, well, we could look, but then we don't know what to do. And now there's some newer treatments that are available that are effective, that really make it worthwhile looking. Or just, we've had patients for years that we think we're doing everything right. They're watching their diet, they're not smoking, they're exercising, we've got their cholesterol down, their blood sugars are good, their blood pressure is good, and they're still having cardiac events. Well, we're missing something. We've been missing something, and it's probably inflammation. And now there's therapy that hasn't been available to us in the past. It could be very effective.
So how do you treat these patients?
So ideally, what we'd like to do is prevent future cardiac occurrences, things like stroke, heart attack, those types of things. And how can we do that? Well, we could do all the things that we've traditionally done: control blood pressure, control diabetes, control cholesterol, watch weight, don't smoke, those kind of things. But we've seen patients still going on and having events over the years. So how do we prevent those? Colchicine, which is a drug that's been around for years and years and years, is kind of, most people think of it as a gout pill. But colchicine in a new lower dose tablet for a medicine called Ledoco, which is kind of stands for low dose colchicine, is a safe and effective therapy to reduce cardiac events. And it's been shown in studies for patients that are otherwise optimally treated to substantially reduce their risk of cardiovascular events by over 30% in patients that were otherwise well treated. For every 35 patients you treat with the medicine, you'll avoid one event,
wow.
which is pretty impressive.
Yeah. How does the drug work?
So how it works is it's a once daily pill. When we think about it for gout, it's twice a day at a higher dose. That can cause side effects and other problems. In this lower dose, it's a lower dose pill, and you only take it once a day. So it's very easy to take. You take it regularly. It's not a limited treatment. One of the things we've seen in trials is that this is inflammation. You could treat it, but it'll come back if you stop treating it. So it's a pill that you'll take every day, and it'll reduce your inflammation, and every year it'll reduce events for you.
And just I'm curious, reducing inflammation in general, I imagine that's better for your health and even some other areas as well.
Probably
Yeah.
so. I mean, it's hard to believe that it wouldn't be. but we know reducing heart attacks and strokes, so those inflammatory things that we see in the cardiovascular system is very effective.
All right. Well, thank you so much for coming in
You
and
bet. Thank
talking
you.
with us on Heart Talk.